The broadcast is now starting. All attendees are in listen-only mode.
Hello and good evening to tonight's webinar. Lovely to have you on the call. My name's Kim Bradley we're just going to start in a moment or two. As I can see, the numbers are creeping up now as everybody's logging in and starting on the call tonight. So just give us a 1 minute or two and then we'll get started. Really looking forward to talking about the subject of blood pressure tonight. Such an important topic. So the numbers are slowing down now, so I think we'll just get on with this exciting information. So a really warm welcome to the webinar and thank you for listening tonight, and thank you to anyone listening to the recording because we'll make this available soon after. My name is Kim Bradley and I've been working with people to help them elevate their health and well-being for many years, coaching people and putting a focus towards wellness rather than illness. And that has been rewarding on many levels to see people take control back and really elevate their health. Tonight's topic about raised blood pressure is really close to my heart, as this is something that has affected our family and in some cases tragically over the years, unfortunately. It's a very important topic and it affects a huge percentage of the population. The subject is raised blood pressure, a sign your body is struggling. Well, let me tell you that around 1 in 3 adults in the UK have high blood pressure. In England, that's 31% of men and about 26% of women. And this high blood pressure is also called hypertension, which is a phrase you might have heard. Half of the people with high blood pressure are not diagnosed and are not receiving treatment. That's quite a shocking statistic. Let me repeat that. Half of all the people are not diagnosed. In England alone, there are more than 5 million people currently undiagnosed with blood pressure, high blood pressure. So one thing we do have to say is that if you're concerned about your blood pressure or you're unsure if you have elevated blood pressure or not, please seek advice from your GP or practice nurse. Many doctors' surgeries offer regular wellness checks, and this is especially important if you're over the age of 50. This webinar aims to highlight the main reasons your blood pressure can begin to elevate, what are the symptoms that may present, and the long-term health concerns, especially if it is left undiagnosed. With self-care being the new healthcare, we will end with some ideas and solutions to help you look after your health and take that control back, and hear from a few people who've helped themselves, changed their lifestyle, and lowered their own blood pressure. So let's just move on and talk about what causes blood pressure to rise. So the main reason, and there may be a few reasons, but we're going to be talking about the main reason because that affects most people that have high blood pressure or hypertension, is due to the damage of blood vessel lining. This lining, this inside lining of your arteries, is called the endothelium, and when it is healthy, in a healthy state, it protects your arteries from any kind of fat and plaque buildup inside your artery walls. Now, there are many different proteins that may contribute to abnormal function of the endothelium cells that make up that blood vessel lining. One of these proteins is an enzyme called NOx5, and it's believed that when the body is hypertensive, the regulation of NOx5 is abnormal and it produces too many oxidants, which are otherwise known as free radicals. You may well have heard of that, free radical damage. And these free radicals basically damage the blood vessel lining. So if you can imagine in your mind like a hose pipe, where the pipe becomes constricted and the diameter is reduced. The same thing happens to blood vessels as they become inflamed and damaged. The small vessels become narrowed and constricted and the pressure inside them increases. As you can see in the picture there, the one with lots of fat and plaque, leaves a very narrow space for the blood to push through. So over time, plaque is laid down inside the artery wall, and this just continues to constrict your blood flow all around your body. And this can happen anywhere. We have 60,000 miles of blood vessels, so this thickening can happen in any parts of your body. So the ideal blood pressure is a reading somewhere between 90/60 and 120/80. High blood pressure is a reading consistently over 140/90. And this is an important phrase from bloodpressure.org, because as it says, high blood pressure is the most preventable and treatable condition. Early warning signs, let's have a look at some of these of blood pressure going up. Well, one of the most dangerous aspects of hypertension is that you may not know that you have it. In fact, nearly 1/3 of people who have that high blood pressure don't even know that there are no symptoms. The only way to really know if your blood pressure is high is through regular checkups. And this is especially important if you have a close relative or that's got high blood pressure as well, just to make sure there's no family connection there. Now, you can buy your own blood pressure monitor device to use at home these days. The general advice is to use them successfully is to measure your blood pressure at the same time of day under similar circumstances, i.e. not when you've done vigorous exercise or gone out for a brisk walk one day and the next day after you've been relaxing on the couch and or just got out of bed. It needs to be similar circumstances, so you don't want to be dehydrated one day and well hydrated the next, or soon after drinking a caffeinated drink like coffee or tea. But according to WebMD, the signs that you possibly may notice are things like severe headache, fatigue or confusion, vision problems, chest pain, difficulty breathing, irregular heartbeat, blood in the urine, or pounding in the chest, neck, or ears. So let's just say that if any of these symptoms apply to you, it would be worth having your blood pressure checked just in case. Now, if your reading is elevated on the first blood pressure test, the British Heart Foundation suggests that the blood pressure is taken a further 2 times so that the body can relax and reduce any kinds of effects of white coat syndrome. White coat syndrome is that phenomenon in which a patient exhibits a blood pressure level above the normal range in a clinical setting. So in a doctor's surgery or in a hospital, the blood pressure can be higher. However, they may not exhibit the same blood pressure when they're in a relaxed setting or in their own home. So some GPs will recommend 24-hour monitoring or regular checkups to see if the hypertension is an anomaly or in a consistent high state within the body. And this is really important. I can tell you a story just this week. One of my family members was telling me that she's getting on a bit, and she's very, very anxious about visiting the doctors. She just hates it. And she had her blood pressure checked, and it was 179/80 on the first reading. A little chatting with the doctor, and after a few minutes, she had another test, and the top reading had dropped to 167. After more chit-chat about a recent holiday, she'd just been on a cruise, and the family, and 10 minutes had gone by, and it had dropped further to 144, which the doctor was very happy about. The trouble is some GPs may be too pushed for time to give you the space that you need to just relax into the appointment. But it's really worth bearing this in mind if you know personally that you feel anxious about going to the doctors or having a blood pressure test. So let's have a look at some long-term health concerns about this. So in your blood vessels, if your blood vessels and your heart are under pressure for a sustained period of time, it will have a knock-on effect on many of the other body's organs and body systems. The body really does not like operating under high pressure for long periods of time. When we exercise, our blood pressure can go up. It can go up for short-term reasons, but long-term reasons, it doesn't do the body any good at all. Hypertensive heart disease is the #1 cause of death associated with high blood pressure. It refers to a group of disorders that can include heart failure, ischemic heart disease, and an excessive thickening of the heart muscle. Other main risks are angina, obviously heart attack, stroke, and any of which can be fatal, but they can come with no warning, and they can leave you with life-limiting conditions. Now, I mentioned this subject was close to our hearts. Last year, we lost a very close and dear friend to a sudden heart attack in his early 50s. And that shocked us all to our absolute core, as we're in a friends group and we're all around the same age. My own husband's father died at 54 of a heart attack. And I honestly am sure you don't want to imagine this happening to you or someone you love. But it's really important that we look at our risk factors and focus on our health so that we can have this active and long life and not ignore these problems. Elevated blood pressure is really something that we need to take control of. So many of the organs in the body are at risk from sustained pressure. Kidney disease can be the result of narrowed arteries and can become a very long-term problem. Your body may begin to retain fluid, and usually further medication is then needed to prevent that from happening. Dementia risk goes up with narrowed arteries in the brain, which prevent much needed oxygen and nutrition to circulate, which, and it's the oxygen that keeps the brain sharp instead of dull. Eyes can deteriorate without sufficient blood supply, and problems such as macular degeneration can occur. Sexual dysfunction is a common side effect of heart disease, of which we hosted a webinar about that last week, and the recording is available to listen to if that's something that you're concerned about. Peripheral artery disease is when blood flow becomes constricted to the arms or legs, more commonly the legs, and this can result in swelling, poor circulation, slow wound healing, ulcers, and at worst case scenario, it can result in the loss of a limb. And people with diabetes are at even higher risk. And so looking after their circulation, if you've got type 2 diabetes or any kind of diabetes, looking after circulation is really absolutely key. High blood pressure treatment typically tackles the symptoms, targeting the end organs such as the heart, kidneys and blood vessels, and not the causes. Let me just say that again. High blood pressure treatment typically tackles the symptoms and not the causes. So what we're trying to do is find ways that we can tackle the causes. Now, fortunately, there are natural ways that you can bring your blood pressure down yourself, either before medication has become necessary, or to support your body when you are on medication, or to work with your GP if you would like to try to find ways to come off your medication. It's definitely worth investigating this. Obvious things like stopping smoking, which is a definite high risk factor to heart disease, looking at your diet, checking the choices you're making, losing some weight if that's needed and you're a little overweight, reducing your alcohol consumption to a moderate level, and keeping your stress low so that you're not in a high stressed state. And as well as perhaps thinking about taking some supplements that we're going to talk about that boost nitric oxide in your body to protect and actually heal your arteries, which can greatly help you to elevate your health. So you may have heard of nitric oxide. Quite possibly most of you listening have never heard of nitric oxide, and that's okay. But let's just have a look at what it is, because nitric oxide is a miracle molecule. That's what the science community call it. It occurs naturally in your body. Your body makes nitric oxide. It's part of its functions. That as we age through the decades, we naturally produce less and less and less nitric oxide. So by the time we get into our 50s and our 60s, we're down to around 35% to 15% nitric oxide production in our bodies. The role of nitric oxide is to dilate the arteries and maintain a healthy inner lining of the arteries, that endothelial lining on the inside. It helps to relax, widen the arteries, and look after that lining. As I said earlier, free radicals can damage the lining, which cause the fat and plaque to build up and calcify. The restricted space for blood to flow is the key reason why blood pressure becomes elevated. In 1998, there was a Nobel Prize for Medicine that was awarded for the discovery that actually an amino acid that we consume it in our diet, it's called L-arginine, creates that valuable molecule of nitric oxide to help protect our system from cardiovascular disease. And I'd briefly like to talk to you about 3 supplements that are shown to help protect people against heart disease, or at least slow down or elevate your health if you've already got it. Now, I've been working with these supplements for a very long time, and we've got plenty of people with results on this, but let me just briefly take you through. They are Proarginine, Body Prime, which is a magnesium supplement, and Mystify, which is an antioxidant drink. So briefly, Synergy worked with some very clever doctors in the field of cardiovascular care to actually create Proarginine Plus. It's an L-arginine supplement that boosts nitric oxide, and it has been shown in clinical trials to reduce that LDL oxidized cholesterol, which is that fat and sticky stuff that you get in your arteries, that's what it's called, when it's been used over time. If we look at the benefits, we can see that it helps maintain healthy blood pressure, it promotes your energy levels, it improves your memory, it helps to maintain good blood sugar levels and reduces inflammation in the body. It's got other vitamins that are useful to your body as well, and it's listed in the physician's desk reference, which is a bibliography of prescribing drugs, and it's listed in there as the highest quality L-arginine supplement in the world for its cardiovascular benefits because it's been so thoroughly tested. And if you really want to explore this subject of nitric oxide and L-arginine and how it works in the system, there is a book actually written by the Nobel Prize for Medicine chap called Dr. Elui Ignarro, and it's called No More Heart Disease, How Nitric Oxide Can Reverse, Even Prevent Heart Disease and Strokes. It talks about how the body creates it and L-arginine and its role and everything. It's really interesting. But this is what the product does, is it's a drink and it's very tasty, and it just helps to regulate your arteries and clean up the fat and plaque inside over time. Now, Body Prime is that magnesium supplement. So magnesium is a master mineral. You know, it's a mineral that we absolutely need in our diet, and so many people are deficient in magnesium. It has a really big impact on the cardiovascular system. Loads of research about magnesium shows how, you know, it helps with insulin and diabetes, heart disease. It increases nitric oxide production. It improves the endothelium dysfunction. So it does everything about supporting your cardiovascular system. But magnesium is also very much a relaxant, so it helps to bring you out of stress. It reduces anxiety. It helps you sleep at night better. And it's exceptionally good for the digestive system as well. So there's lots and lots of things that magnesium is good for. And then Mystify, which is packed full of antioxidants. So the sole protection against free radicals that we get from our environment is antioxidants, and we find those richly sourced in berries. Mystify is the acai berries, one of the highest sources, cranberries, goji berries, blueberries, all these dark reds and purple berries, because they have the highest antioxidant levels. So if you remember what we talked about, how antioxidants get rid of that free radical damage, which is helping to heal and protect that lining which is being damaged by free radicals and setting you up with the plaque formation in the first place. So everything about this is to help reverse where possible, if your body is capable of it. We're all unique, and that's why really what we're talking about is elevating your health by some degree, or to protect your health going forward. You know, once you're in your 30s, 40s, 50s, 60s, we want to really protect that health so that you can continue to live a long and active life. So what I've lined up for you guys is a couple of people who have really sort of had some serious problems with their health and their blood pressure, and they've decided to take some of the control back. And I've just invited them to share for just a few minutes how things were for them and what they've done. So Freeman, would you be able to just unmute yourself there and tell us what was going on for you with your body, your blood pressure?
Well, I used to really believe that my body was okay. I didn't need anything else. Then one day I went into a sports center, and there were people there who were taking blood pressure and all sorts of things. And then I discovered that my blood pressure was 160/100.
Wow.
And then the person who was in there actually booked me with my doctors. He said to me, you must go and see your doctors in 2 weeks' time. So I made an appointment. And I said to myself, I really don't want to have any tablets to take. So what I did was I went back home and said, I will take ProArginine, 1 in the morning and 1 in the evening, which I did, you know, really religiously. Mm. Then when I went into the appointment in 2 weeks' time, I went to the doctors. When they took my blood pressure, it was 125/80.
In 2 weeks?
In 2 weeks, yes.
Wow.
So I kept having to have the drugs. So from that now on, I check it sort of, you know, nearly every week to make sure that it's within that range.
And what's concerning there, Freeman, is that you obviously didn't have any symptoms when your blood pressure was high because you thought you was well, and then you went.
Yeah, I didn't have any symptoms. I was just. Yeah, it came as a surprise. I thought, well, I'm fine. I'm doing whatever I want to do, no problems.
Yeah. And so how have you felt? Now you know that your blood pressure is under control. How long has it been under control for, Freeman, now?
This happened 2 years ago. So since then, I've always been taking the ProArginine, the Mystify, and obviously I'm also taking the magnesium as well.
Yeah. So it's been under control for 2 years, which is fantastic.
Yeah, it's been really good for the last 2 years.
And so how do you feel now in yourself?
I really feel better. I think people can even see me because I drink it all the time. I'm going out. And what is it that you're drinking? I just said to them, don't worry. It's my lovely drink. I won't go for tea or anything else.
Oh, well, you know, I'm sure you must feel as well relieved, really, Freeman, that you know, your health's not going downwards, it's going, you know, your health is going upwards, I should think.
Yeah, I think I'm more like a teenager now.
That's great. Well, you know, that's what we want, you know, life's too short to give up, you know, we want to be like teenagers for as long as possible. So I love that. Thank you so much for sharing what's going on with you, Freeman, you're a star.
Thank you.
And I've got a friend of mine, Marjorie. We've been working together on your health and well-being and for some time, Marjorie. So would you tell everybody what happened to you, please?
Yeah, of course. So just to set the scene, I was diagnosed with high blood pressure. It must be going back 20 odd years, like 15, 20 odd years. And from that day forward, I've always been determined to get rid of the medications because of the side effects. But I took them and, you know, life carried on. But it was a couple of years ago, if you remember, and I got very unwell at an event and was taken to hospital. I had headache, I had palpitations, I had tight chest. I really did feel that something really bad was happening. Anyway, they did a load of tests at the hospital and nothing untoward apart from really very high blood pressure. I mean, when I say high, it was over 200, over 100 or something ridiculous like that. And it was very, very frightening. So I took 2 Apraginine twice a day and it gradually came down. But the thing is, what I found very interesting was that my blood pressure went up on 2 lots of meds. After taking the Proarginine, it started to come down, it gradually came down and went down into the normal range within a few days. I kept monitoring it. I've got my own blood pressure monitor. And the swelling of my ankles went down, and I gradually reduced the meds, came off one of them, kept one of them, and did it really, really very gradually. But what was also good to know was I was able to exercise more, because I couldn't really do it very much before because I was getting out of breath. I couldn't walk very far, but then I started to be able to walk much further, and that helped bring the blood pressure down even more. I changed my diet. I added in the Mystify and the magnesium, and it just came down and down and down, and I wouldn't be without them now. It's actually really made a big difference to me. I tell the GP about it, and he still insists that I should take the medication, but I don't take it very much, I have to admit.
Do you mind me asking, what side effects did you find that you found? Because obviously you said you really wanted to come off medication. You kind of knew that in your heart that that's what your personal journey with this, that's what you wanted. What sort of side effects were you getting when you was on the medication?
Well, the fatigue, one of the blood pressure meds I had, it was really fatiguing me. I couldn't really do very much. I couldn't exercise. I had no energy. And then on another one, my ankles came up, like balloons. And again, you just feel lethargic. Headaches, headache being a symptom of, if your blood pressure is really, really high, the headaches are terrible, really like a thudding in the head. But I noticed that I would still get the headaches, even taking the medication. And you just didn't feel right.
Yeah.
You knew something was going on, and you didn't really know whether it was the blood pressure or the medication. And then when you'd read all the symptoms that you could get from taking the blood pressure, the medication, it's really quite frightening. So some of the things that could go wrong taking the medication, so I really didn't want to take it.
Yeah, and I think that's the thing, because blood pressure treatments tackle the symptoms and not the causes, but they can create their own set of symptoms. As taking these sort of targeted nutritional supplements, if you like, it's not just any old supplements, but targeted nutritional supplements for this particular issue. It's actually helping the body to heal itself, and as the body starts to heal itself, you start to get more energy, which
absolutely
seems to have enabled you to think more about, well, how do I want to change my life? Like with your exercise and your walking and with your diet. So it kind of sets a different catalyst in motion, where you've got more energy to do these things and think about these things.
Yeah, and that in turn helps to keep the blood pressure down. Obviously, I wasn't able to do that before because the medications were stopping me. And I regularly walk between 4 and 5 kilometers most days. The diet I have now is totally different to what it was, but I never got any advice from the doctors. They just treating the symptoms with medication, and that was it. It didn't really help.
Yeah. Well, I really appreciate you sharing this story tonight, Marjorie, and hopefully, this can give hope to people, to hope that there are lots of things that you can do and holistic approaches that you can do. So thanks so much, Marjorie, for sharing. So, bless you. All that remains to say is thank you so much for listening to this really important topic. I really hope that you've learned something new, and maybe it's inspired you to look at your own health in some way, or maybe a family friend or loved one. If that's the case, all we ask is that you get back to the person who's invited you to look at the recording or come to this webinar tonight, and just have a chat with them and find out some things and get some questions answered, and and see if we can be of service to you to help you start moving your health back in a really positive direction. So with that, talking about moving your health in a positive direction, we've got the lovely Kerry Madgwick speaking tomorrow. Kerry also works in the health world for many, many years, and she's going to be tackling the subject of hormones. I mean, for a lot of women, it really is hormonal hell, or at least very much uncomfortable. Not just through menopause, but through many different stages of life. I'm sure the same could be said for the men. If they're not hormonal themselves, they probably have the headache of the women that are, bless them. So come and have a listen. It's going to be a really informative webinar tomorrow night, Hormone Hell to Hormone Heaven. And I think we'll all learn a thing or two about that. So that's at 8:30 tomorrow night, and you can register at the foundationsforelitehealth.co.uk. Also on Sunday, if you're intrigued about Synergy and their research, what they're about, their ethics, their ethos, and all those things, then come and join us on a Discover Synergy call with the lovely Julia Rywald. She's going to be taking you through that and talking about it as well as a business opportunity for people who just really passionate about helping a lot of people change their life. So thanks so much for listening, guys. Have a lovely evening, and I'll speak to you all soon. Take care.